Good afternoon, everyone, and thanks for joining our call today. MIPS 2019, getting your facility-based providers in on the fun. It should be a very good call. Our presenters today are Holly Ahrens. She is a certified MIPS quality professional and a program manager at the Great Plains Quality Innovation Network. She is based out of South Dakota. And Holly has been a change agent in the state of South Dakota in the efforts of adoption and optimization of electronic transactions, EHRs, and interoperability across the state. She is working on the GP Quinn tasks of cardiovascular health, transformation of clinical practice initiative, and the quality payment program. Also presenting today, we have Nancy McDonald. Nancy has been a nurse for 20 plus years and holds her certification in healthcare quality. She currently works for the South Dakota Foundation for Medical Care as the state program director, and that is included in the Great Plains Quality Information Network. And Nancy has provided technical assistance to South Dakota facilities for several years on the payment adjustment programs. And she's also worked with hospitals on many patient safety issues, from readmissions to adverse drug events and much more. So without further ado, I am going to turn it over to Nancy to get us started. Thank you.
Hi, Patty. Sorry, I hit the wrong button. I didn't mean to zoom that in on everybody. Happy Wednesday, everybody. This is Nancy. Here's a quick overview of our objectives that we're going to be going over today. The first one is we're going to be discussing how facility-based medical providers can participate in the MIPS 2019 by utilizing their hospital value-based purchasing program measures. We have a review of our crosswalk measures between the two programs, and then we're going to provide some practical solutions for your MIPS participation. So I've been asked by the Great Plains Quinn QPP team to give a brief overview of the hospital value-based purchasing program, and then after that, Holly's going to take that information and tie it into the facility-based MIPS participation for you. So I think I've used this slide and this quote from Don Berwick a couple of times in presentations that I've done, but it's still pertinent today, and it's especially for the hospital value-based purchasing program. And he asks the question, instead of payment that asks, how much did you do? We're now at a place that we ask, how well did you do? And more importantly, how well did the patient do? And so now we're in a time of outcomes in our healthcare world. And the value-based purchasing program really was designed to promote those better outcomes for patients in hospitals. So the program encourages eliminating, reducing adverse drug events, adopting and utilizing evidence-based tools, improving patient experience of care, and increasing transparency, all while trying to increase quality of care and lowering patient costs. This slide represents the fiscal year 2021 or calendar year 2019 performance period, hospital-based value-based purchasing domains, which are 4, as you can see here. The top left one is the clinical outcomes domain, which includes your mortality measures. The top right is the person and community engagement domain, which is your HCAHPS or patient satisfaction scores. The bottom left is the safety domain, which is your infections. And then the bottom right is the efficiency and cost reduction, which is your Medicare spending per beneficiary. This slide is the same as the previous slide. It's just a little different look without all of the actual measures that fall into the domains. So you might be asking yourself, do we qualify for the hospital value-based purchasing program? And so I wanted to include this eligibility slide in here so you can see the minimum reporting requirements. And for clinical outcomes, it's 25 cases and at least 2 of the 5 measures, and at least 100 HCAHPS completed satisfaction surveys. I know a lot of smaller PBS hospitals in South Dakota struggle getting that one. And so for safety, the safety domain, hospitals must report the applicable minimums for at least 2 of the 5 measures. And for the efficiency and cost reduction, at least 25 episodes of care for the Medicare spending per beneficiary. So here are a few key items in the hospital value-based purchasing that are important to how hospitals receive their total performance score. And we'll get into these a little bit in a few slides down the road here. But achievement points are awarded by comparing a hospital's rates to all hospitals' rates from the baseline. And then, so you can get scores from 0 to 10 will be awarded, as you can kind of see here on this slide, the first 3 bullet points under achievement points. And then we have improvement points, and they're awarded by comparing a hospital rates to their own baseline. And then lastly, we have consistency reports, and those are awarded by comparing a hospital's HCAPs to the hospital's HCAP rates, which are 0 to 20 points awarded here, as you can see as well. The HCAP's consistency score is determined based on the hospital's lowest dimension score from the performance to calculate a consistency score. So the higher a hospital's lowest dimension score is above the floor or the worst performing hospital dimension rate, the more consistency points the hospital will receive. So a hospital can earn between 0 to 20 points towards this domain. And I'll show you an example of this in just a couple of slides. So you might be asking yourselves, how do we get a total performance score if you're not familiar with this? CMS calculates a total performance score by combining the greater of either the hospital's achievement or improvement points for each measure to determine a score for each domain, and then they multiply each domain by a weight, which we saw that slide earlier is 25% per each domain, because we have 4, and then they add those scores together, and then that gives you a total performance score. And so hospitals with at least 3 of the 4 domain scores will receive a total performance score. So if you have 2 or less, you will not receive a total performance score. So I found these examples on qualitynet.org and wanted to review these with you. And so this is, like I said, just kind of a snippet from qualitynet.org. And this particular example has the quality care domain. And you can see the baseline period, which is, 1 and 2, these red circles up here, number 2. And then your performance period, which will show, how this example is number 3. And then as well as the achievement points, which is number 4. So you can see achievement points, improvement points on these. And then remember when I said on the previous slide, they'll always take the higher of the 2 achievement points or improvement points. So you can see that they've taken the achievement points on this example. And so then lastly, at the bottom of number 5, you'll see an example of, eligible clinical care measures of 404, and then they have an unweighted domain, and then they take that times 25% and give you a weighted clinical score domain of 5. So for the sake of time, we're not going to get into these deep, detailed reports too much. So I want Holly to be able to spend some time on that. But I'm just giving you a brief overview on what these reports may look like for you. This is the person and community engagement domain that, again, shows the baseline period, which is the 1 and 2 of the blue circles here, and then the performance period of how this particular hospital did, and then the dimension score, which is 5. So you can see that here. You see the achievement points and improvement points. Those are different. And then the dimension score that they're actually going to take is the higher of the 2. So the dimension score will always show the higher. Again, they'll add those up, and you'll see an unweighted score and then a weighted score here in number 6. This is the safety domain that also shows the baseline periods in number 2. And then the performance period for this particular example, these are your infections for this particular hospital. You can see those in number 3. And then the improvement and achievement points is number 4. You can see those. They only qualified in 2 of these 6 domains. So you can see down here on number 5 where it says eligible safety measures, 2 of 6. And then this weighted domain was 20. So this is an example of the efficiency and cost reduction report of what it might look like for you. It has all the same sections as the previous 3, and it's showing the weighted domain score in number 5. So this is a report that I'm very familiar with when I would give technical assistance, and these are the reports that we can see for our hospitals. It's called the Percentage Payment Summary Report. Again, this is just an example from qualitynet.org, and this particular example shows a facility with a total performance score of 57.875, as you can kind of see in row 1 way over to the left. And then it shows it in comparison to the state, which was 45, and national, which was 40 in this example. So this particular facility did pretty darn good. And then in number 2, all 4 of those scores, you can see the unweighted and the weighted scores. And then how you get your total performance score is you add all 4 of these weighted domain scores up. So 16, 11, 20, and 10 equals your 57.87 for this total performance score. And then, just for the sake of time, I won't get into the number 3 on the actual payment adjustments. I don't think that's our focus for our call today. But if anybody has any questions on any of these total performance scores and would like to know how to better read them, you can certainly send me an email or give me a call. My connection information is at the end of these slides. I'd be happy to help. So this is just a prettier example of the hospital value-based purchasing domains and how a total performance score is calculated. So again, it kind of takes the unweighted domain score, multiplies it by the domain weight, which we have 4, so 25%. And then it gives you your weighted domain score. You add those all together, and this particular performance example, total performance score is 73. In my time spent putting these slides together for this presentation, I located the snippet, and it basically lists the NQF measures on the left, and then it also includes hospital value-based purchasing domains. And I thought it would be of value as we now begin to talk about how the hospital-based clinician can use the hospital value-based purchasing to participate in MIPS. So then you might be asking yourself, what does this mean for me as a hospital clinician-based provider? So your contribution to the total performance score can now translate into your MIPS quality and cost performance. And my recommendation, just covering the hospital value-based purchasing program part of this presentation, would be to any providers that are listening on the line is to work closely with your quality improvement, patient safety teams to help make your total performance score the best that they can be. And so with that, I'm going to hand this over to Holly. Holly, I'm going to give you the ball here.
All right. Thanks, Nancy. Well, that was really informative because I know some of the quality managers that work in the clinics have providers that are deemed facility-based, and they've been looking at their clinic measures all this time. And so it's good to see that, the measures that are being tracked at the hospital can now be used for our MIPS participation, and understanding and seeing the crossover between some of those measures between the two programs was good to see. And this just leads to some of the goals that CMS has been telling us for these programs is aligning them. For one, we did see several of the measures do align with the program. And then also decreasing provider burden. This is one of their number one goals for the next few years, and making sure that they can provide options for providers to ensure that they can participate in programs. So the option they're providing is to use this facility-based score for participation in MIPS. So let's figure out, now kind of show you how they make that determination of whether your providers are facility-based. The number one thing is that they have to meet the MIPS eligibility, the standard eligibility, and that low volume threshold requirement. I'm not going to go fully into that because we've covered that on several different webinars, and we have links in our website to give you that information. But we want to look at individual determination for facility-based. For individual determination, they look at your Part B claims, and they'll be looking at October 1st, 17 through September 30th, 2018 with a 30-day runout. And if you have billed at least 75% of your professional services at an inpatient hospital, on-campus outpatient hospital, or emergency room, and you see those places of service there and the codes that would correlate to on your claims for the place of services, if you've had 75% of those services at one of those coding places of service, then you are through the first round of determination. And if yes, then you would have to build at least one covered professional service in either 21 or 23. So that's an inpatient hospital or an emergency room in that time period as well. So it's a two-step to have an individual determination. Now for a group determination, and this is to be a facility-based group, at least 75% of your MIPS eligible clinicians that are in the group are determined to be facility-based. So pointing back to that individual determination, if 75% of your MIPS eligible clinicians have gone through this individual determination process and been deemed facility-based individually, then you could be deemed a facility-based group. At this time, facility-based does not apply to MIPS APM participants. So once they make the determination, they have to attribute your providers to a hospital tax ID number. So they first do an individual attribution. So this is where they attribute you to the hospital TIN where your services were provided to the greatest number of Medicare beneficiaries. So this is a little different than what we're used to for attribution. Usually it's the plurality of services, but this attribution will be to the greatest number of Medicare beneficiaries of the TIN that you provide that to. Now, if you practice at multiple hospitals and let's say you would have the equal number of beneficiaries at both hospitals or 3 hospitals, you will be attributed to the hospital TIN that has the highest performance score. So this is kind of behind the scenes. This isn't something that you could really have much control over, but it is good to know, possibly through your claims or knowing, where you have your most services and beneficiaries are treated, to have some idea of which TIN you'll actually be attributed to. Now, for group attribution, you'll be attributed to the hospital at which the plurality of the clinicians in the group are attributed individually. So once individuals are attributed to a TIN, they'll say, okay, we'll look and say the majority of their MIPS eligible facility-based providers fall into this TIN, so they will be attributed to this hospital. So these are a little different, and if you have some question on these, just let us know. So what are the data requirements? Because when you participate in MIPS, there are different data requirements, and depending on what type of provider and submission type you choose, there are different requirements. This one is pretty easy, and if you are facility-based, and then you will have your TPS score, your value-based purchasing total performance score. CMS will automatically apply that to your quality and your cost categories, okay? But you must still enter your improvement activities and promoting interoperability data into the QPP portal. One of the things I want to make sure you understand for a group that's facility-based, you still have to submit your IA and your promoting interoperability categories on the portal, but ensure that you submit as a group. This allows CMS to know that these individuals that you've identified in your group are part of a group submission as the facility group as well. So this is just an FYI tip when we get to that point of submitting into the portal next year. You will submit as a group your PI and IA information. All right, so how are they going to translate a total performance score from the value-based purchasing program to a MIP score? This is the million-dollar question, right? So I'm going to just briefly go through it here, but then we're going to go into it in detail when we get to the 2 steps. So they take basically your MIP, your TPS score, and they're going to use it for your quality category and your cost performance. Okay, so when Nancy was showing us how they broke down the TPS and how they weighted it and did their calculations, they do the same thing in TPS. They create percentiles, okay? And they'll say, okay, this score is in the 60th percentile or the 80th percentile. And that's how they break down some of the payment adjustments as well and figure out how well you're scoring or what your outcomes are. And we've seen that in MIPS throughout the years as well, that you are placed into a percentile and there is, your adjustments are based on that. So they're doing the same thing when they're translating your TPS to a MIP score, and it's a 2-step process. So step 1, they will establish a percentile performance, and it's comparing all the hospitals that participate in the value-based purchasing program, okay? And they will give you your score, and let's say the score is 60. Your TPS is 60. And once they look at all the hospitals performing, they say, okay, 60 is in the 80th percentile. Okay, so that's step 1. Step 2 is, once all that MIPS clinicians have submitted their scores and for that participation year, they also set percentiles. And they, and just like the TPS, they say, okay, they look and say, okay, they were in the 80th percentile for their TPS. So we translate that to the quality 80th percentile. And that 80th percentile score is, and this is just for example, is a 55. So in your quality MIP score, you're going to get a 55 based on your 60 TPS. Then they look at cost and they say, okay, the 80th percentile in cost is 66 score. So they would give you in your cost category a 66. So a 60 score in TPS could translate to a quality score of 55 and a cost score of 66. And these are purely examples. These are not actual scores or percentiles at this time. But just so you understand, they will establish you your score for TPS, place you in a percentile in the value-based purchasing program. Then they'll translate the percentile to the percentile in MIPS. All right. So they've given you the ability to look at a preview of what your scores could be. So they have on the QPP portal, they have it's called the facility-based preview. And this just looks at your quality and cost performance of what they could look like if you're identified as a facility-based provider and attributed to a facility during that fiscal year 2020 hospital value-based purchasing score. So these are not your actual scores, but it just gives you a preview of what it could be. So once you go into the quality payment portal, you click on the facility-based preview in the account dashboard on the left. See that right here. All right. And once you do that, you'll come to this screen that says facility-based preview, and they give you this little warning here, this information is not used as your final score. It's informational purposes only. Again, saying, you know what, we're just kind of speculating. It'll give you your TIN and your hospital name. You click preview score. And then it gives you your clinicians here. And they gave us a preview of this through CMS, and this little note right here that says no facility-based preview data is available for the practice, but the individual facility-based preview scores can be viewed. That's what you'll be reviewing. So they've said this clinician has been individually determined to be facility-based, but they haven't made a facility-based group determination. That's what that means. So don't say, oh, well, they don't have any data and we're not facility-based. No, it means that we haven't determined if you're a facility-based group at this time. So you can preview individual scores, and you would click on that right next to their name. And you would come to this, and it would show you what hospital. It would give you the MPI and the TIN that you're looking at, and it will then show you that the percentiles are there. It gives you your TPS score on the left. As you can see, this score was 54.84, and that goes in the 80th percentile. So that translates to a quality 64.36, and they do the weighting, which would be 45, and that category contribution then would be 28.96. So they're giving you, they put them in the 80th percentiles, you see in quality, and then in cost, they do the same thing. They do the weighting, and then they give you a score. And then the next thing, they just graphically show you how this compares to other performances. So you can see that your performance rate will be noted in an orange circle and through the mapped percentile, so you can see where you are as a preview. All right, well, if you have any questions about that, please use the chat. I know one question that we were anticipating was, well, what if I'm in a critical access hospital and they don't participate in the value-based purchasing? Well, CMS is not able to give you a facility-based score, which means that you won't be a facility-based individual clinician nor group. So that means you'll have to participate in MIPS via another method. So if you do have eligible clinicians that are required to participate in MIPS, you won't be able to do it if you're in a critical access through this type of participation method. So benchmarks. Will those that are incorporated in TPS, those that are incorporated in TPS for value-based purchasing, they will use those that they already have. There's going to be no new benchmarks for the TPS within MIPS. So the benchmarks that they provided for the quality measures, those will remain for 2019. There will not be any new that will be a crosswalk between TPS and MIPS. So what should you do? Always the first thing, go out and check your status if your providers are eligible at qpp.cms.gov and use use the eligibility status tool to see if you do have eligible clinicians. Then log into your QPP portal and look at that facility-based preview to see if your providers have a preview score. And then do some analysis and see if it would be more beneficial to you to remain using your current submission method, or if you should start using the facility-based method. And I know that our assistants will be, focused on this if we do have some providers that are facility-based and they are in PPS hospitals, that we'll be providing that assistance to them to kind of do that analysis of, how much effort is it now that we're putting into submission can this be done at the hospital, and it's kind of automatic that CMS will apply this to our quality and our cost? Will we have better scores, and will that impact the payment adjustments that we may or may not have? So these are all things that you need to consider. And if you have not been monitoring your TPS or your value-based scores, this is just a reminder to make sure that you are tracking those, and get a hold of the Quinn, and like Nancy McDonald, she's working in the South Dakota hospitals and all the states across the Quinn. We have dedicated staff that are working on these programs. So get in touch with them if you don't know how to monitor your scores or get the information, or how to analyze your scores or improve them. Here's a few resources we have for you on the Great Plains Quinn, the QPP Resource Library, QualityNet, and then the Quality Reporting Center. And here's our contact information. Do we have any questions out there? I think that is probably we'll give some time for that, because I know these are some concepts that are new, and they are, some formulas that may be difficult to wrap your head around. So if we have any questions, did we have any in chat?
I don't see any questions in chat at all.
Okay.
Janelle, can we open up the phone line?
Yeah.
I will do that. If you would like to ask a question, please dial *6 to unmute your line.
Nancy, I had a question for you. For 2019 participation year of MIPS, they're going to be looking at the 2020 fiscal year. Is that the current value-based purchasing year that they're in, or is that the previous year?
Well, right now we're in the performance of calendar year 2019, which is fiscal year 2021, which is that first slide that, if you want to go back to that.
Okay.
And you can see those baseline and timelines on there. So we're already past the performance period of fiscal year 2020. A little bit further back. Probably slide one more. There you go. Do you see those performance periods up here that show January 1st through December 31st, 2019?
Okay. So when they look at those claims, it's within that performance period. So yeah, so it's looking at what their performance period that they're in right now. Okay.
Correct.
I do see a question from Donna McCarthy. Will CMS do any behind-the-scenes analysis to compare the facility-based score and the MIPS submission and choose the best score? Yes, Donna, they will. If you happen to be a facility-based provider and they automatically pull over your value-based TPS, and then you also submit your MIPS quality and data through the portal or through some other means, they will choose the best score out of those submissions. So this is one of the things CMS does, that they're always choosing the better score depending on what they are provided in terms of submission. Great question.
Any other questions out there from anyone? As long as we have these subject matter experts on the line, let's get some questions to them.
You know, Patty, this is Nancy. I'm always the one that when I sit on these webinars, I'm always the one that's afraid to ask the question. And so really, truly, honestly, if you have any questions, please feel free to send us an email if you have a question and you don't want to speak up on the line. Please feel free to send that email. We're here. We really are here to help.
Donna has another question. Am I understanding this correctly that we would not have to submit the facility-based score? That will be done independently by CMS?
Yes, for MIP scoring, CMS will take what you've submitted for your value-based purchasing program, and they will automatically apply it if you are deemed facility-based. Now, Nancy, you might want to speak to the requirements for submission for value-based purchasing.
I'm not sure how submission of the total performance score plays into the MIPS, actually, but for those of you who qualify for the value-based purchasing, you will automatically get those provider-specific reports that I kind of reviewed. So you'll see your total performance scores on there. And those should come to you via secure file transfer via QualityNet. Anybody has any questions on those, you can certainly email me too. We can help you try to find your value-based purchasing report.
Hopefully that answered your question, Donna. And just a reminder that the TPS being translated to your MIP score only is going to be for your quality and your cost categories. So you still will have to submit your improvement activities and also your promoting interoperability. And then Donna has another question. When attesting for MIP, would we need to declare that we want to submit for facility-based? No, this will not be something that you have to declare or register for in a certain time frame. CMS will review those claims and automatically identify you as facility-based, and then we'll have that preview available to you on the QPP portal. So no, you won't have to attest for that. And do not apologize for questions. We love questions. Anyone else?
Again, we're displaying the contact information for Holly and Nancy. You know, like Nancy said, if you don't feel comfortable chatting in a question or asking one over the phone, please feel free to email Holly or Nancy, and they can help you out with this. Any more questions? Well, hearing none, I guess we can give you back some time in your day, but we really, really appreciate you spending your time with us this afternoon to listen to the MIPS 2019 for your facility-based providers. Again, if you want to contact Holly or Nancy, there's the information there, and it's all in your slide. And Janelle also put the link for the slide deck right up in chat. It would be closer to the top of the chat feature. So if you want to go into that link and print out the slides, please feel free. This is recorded, and so will be posted on the GP Quinn website if you would like to go back and re-listen to it, or if you have colleagues that you think that this would be beneficial to hear, that link will be posted there. It typically takes, Janelle, about a week or 2 weeks?
5 to 7 business days.
Oh, okay. So be watching for that. But thanks again for participating today, and have a great rest of your day. And thank you, Nancy and Holly, for the wonderful presentation. Very good information.